Thank you all for being here on a Saturday morning. Actually, weather kind of worked out. It's nice when it's a rainy Saturday because then I don't feel so bad when people come in. It's all nice and hot. But thank you all for being here. In this 3-hour workshop, we're going to cover a lot of stuff. Jamie's like, Dad, is it cool? Not cool. No, we're going to take probably half an hour, 40 minutes up, just to kind of introduce to you guys some more information on heel pain. Dr. Clark is our main speaker today, so I'm just going to give you a quick few minutes of background stuff about why we're talking about heel pain, and then he'll take over and give you all of the details. Towards the end then, as we start to educate you more about what causes different types of heel pain and ankle pain, we're also going to start to talk about what successful treatment looks like. And when it comes down to heel pain, as a physical therapist, we deal with all sorts of different types of pain. And as a foot specialist, of course, Dr. Clark has his own niche. But heel pain is one of those ones that it's tricky to get rid of for a lot of people. And if you think about it, it makes a lot of sense, because when your foot hurts, and what are your options really? Don't walk on it. That works for a little while. But for the average person with foot or ankle pain, they're still walking on it continuously. Whereas someone who comes in with a shoulder problem, let's say, I can say, okay, well, let's, take it easy on that shoulder for a little while, right? Let it feel better, and then we'll rehab it from there. So feet are a lot trickier. And I'm not going to jump the gun too much, but when it comes to successfully treating your feet and your ankles, you really have to get serious about kind of a multidisciplinary approach. Because if you're just willing to do one or two things, you may get results eventually, but it's going to be slow. So that's why it's really nice to have someone like Dr. Clark who we can collaborate with. And when you're looking at things like footwear and stretching and hands-on techniques and taping and splinting and all sorts of things, you just have all the tools necessary to help you get better as quickly as possible. And this time of year, do you see a surge this time of year, Dr. Clark?
Yeah, people are more active now.
Yeah, definitely. As the weather gets nicer, we're seeing a lot of people coming in with heel pain. And maybe it's been lingering for a while, but now it's very apparent. Like, okay, now we got to do something, because I'm trying to get outside. I'm trying to switch up my footwear a little bit maybe. I've been writing a lot lately about flip-flops and sandals. It's like, so, when you get to that point where you can no longer comfortably go barefoot, or you can't wear a sandal, and obviously there's pros and cons to doing that anyways, but when you can't do it, you got a problem. And if there's any like hikers or athletes, that's a problem too. So anyways, very common problem, so I'm glad you guys are all here today. And I'm going to turn over to Dr. Clark here, and he's going to go from here and tell you all about what's going on down there. So here's Dr. Clark. Off laugh.
Yeah. It's a pleasure being here. I'm glad you all took time out of your Saturday to join us. Thank you very much for your time. I know we have people from all different facets of life and work and whatever, so it's nice to see you all here, and I appreciate Luke joining us. He calls me Dr. Clark. He's a doctor also. So I'm Brent. He's Luke. We've done this a couple of times, and this is a great opportunity to share some of our knowledge and our know-how, and being able to help others with the same problems that afflict actually about 10% of the population. So it's a very common problem. Very, very often happens. It doesn't necessarily matter if you're male or female. Tends to often, the heel pain tends to be a little more common in those that have a little more weight than others, but that's not, that can cause more pressure on their feet, as you know. But we'll talk about a few different things today. I'm going to talk about a lot of some of the things. I just brought a couple little slides here. They'll cycle through. Wanted to talk about just a little bit about our training. My office is actually right next door, so we're neighbors across the hedge here, and it's good to have such a great group. They've even invited me over to come and work out sometimes. That's nice. Good. Or watch a game. Good people. So you guys you're in good hands. We go through, both myself and Luke go through intensive training for years, not just a couple of years out of high school, but we go through, get our degrees in college, and then going on to getting going into further schooling. And in my case, 4 years of podiatry medical school, and then on to residency, to at least 3 years now of residency training. So doing surgery and other, just people are surprised when you say, oh, you know, what do you do as a foot doctor? We see a lot of problems, not just toenails and calluses, as a lot of times you think a podiatrist might have. So one reason why I got into this profession, I get this question often. They're always like, why did you choose feet? You know? And, of all things. And for me, I love our family. You know, we've had foot problems in our family, so interest in that to really help family members. We are the Family Foot Center, so foot maladies can happen throughout all ages, and so I love that part of it. I enjoy surgery. I enjoy doing surgery. That's a great part of it. Sports medicine. Just of a side note, my daughter's running a 3200 later on here in districts today and throwing the discus, and so we do a lot of sports medicine and helping with some of the clinics around. Dr. Tanner of our group, he actually works with the Gonzaga basketball team, and so that's just a little bit about us, and we're always learning and trying to get help others in any way we can. So we'll talk about a few different things today. Generally, when people think of heel pain, they hear the term plantar fasciitis, and that plantar fascia is a little band that goes from the back of the heel to the toes, and it acts like a little cable. It acts to, as you push off, when your foot pushes off, it raises up that arch, so it gives you a little more arch, that plantar fascia. Well, sometimes that gets torn. Sometimes there's little micro tears in that ligament, in that band, that fascia. People talk about pain first thing in the morning when they get up out of bed. That's that first step pain, or after they've been working all day, and then they sit down and they relax, if you ever get to do that, and then you step back down on it, and boom, that heel pain. That's very typical of plantar fasciitis. It's a ligament that tears, and it gets, it has that repetitive injury process that goes on while you're sleeping, your foot relaxes, and then you get that repetitive tear or injury of that process. And so somehow we have to stop that process. So the most common problem is plantar fasciitis. It's an injury of that ligament. Often, has anybody ever heard about that before, about plantar fasciitis? Or I hear people, they have all different words for that, different ways of saying it, but that's generally the common way. And we're going to talk about different ways to treat that. In our clinic, generally 80% of the time I can get rid of that heel pain with just an orthotic, a good orthotic, and even an over-the-counter one, as Rachel was saying, a good supportive orthotic, and a night splint. But basically, that night splint is it's going to be a somewhat dynamic night splint. It's something that you can sleep in. That'll help keep some of that pain away. And so, I generally don't give shots on the first date or inject on the first, and it's important, I think. And we do sometimes, if the pain's bad enough, sometimes an injection is needed, a steroid or cortisone injection, as they talk about. Sometimes we do that. That helps to jumpstart the pain and help things get going. We've seen a lot of people that just get better just as a result of great therapy, great, rehabilitation, that stuff. You guys do a lot of, the physical therapists do a lot of work to keep them out of our offices. Not that we don't want to see you, but then sometimes we will, they'll send them in here to get orthotics or something to hold that correction or hold that and prevent that from coming back. We're going to do a little strapping or taping here, exercise here in a little bit, and we'll show you one of the simple, easy methods that will mimic what an orthotic might do. Okay, so we'll talk about that. Generally, for most of the treatments, for most of the problems that might happen in your foot, an orthotic is very helpful.
You're welcome.
A custom orthotic. There's three. I talk about this painful triad though. There's three things that sometimes it's not plantar fasciitis, and so I'll just a few minutes on other things that could be this problem. Often, sometimes people talk about a sharp shooting or zinging pain. We call that, just as you have carpal tunnel, sometimes you can get tarsal tunnel syndrome. And tarsal tunnel is right in here on the inside of your arch, right on the inside of that. There's an artery, vein, and a nerve that goes right along the tendons that actually help pull up that foot. And so it's right near where that plantar fascia usually occurs too. So sometimes it's hard to distinguish those things, and there are tests that we can do to help to distinguish that. It's hard. There may be a space, there may be something in there causing that space to be occupied, like engorgement of vessels or tendons that are swollen, torn, or other things like that. And another thing is a tendon. The other third one of that triad is, and since we got a board, we can write this down. One is the plantar fasciitis. Two is the tarsal tunnel. And yes, I write like a doctor, not like not like Luke. Luke's got great handwriting.
That's pretty good. That's Ashley above you, not me.
Oh.
Nice
So the third one is this posterior tibial tendon. And what happens is that tendon, we call it, one of my friends calls it the water balloon tendon. Basically, when it acts to hold up your arch. So when your foot, or when you're throwing a water balloon, or you're in a water balloon contest, where'd the little guy go? I don't know. Anyway, you remember, if you catch that water balloon and you don't go like this, then it just blows up on you, right? So that does that tendon acts, it kind of cushions your fall or the blow or the impact of your body. Hundreds, thousands times, however times, what are we doing, 10,000 steps a day? You know, that tendon's working, yeah. That tendon attaches right here. So there's three things that are right in that area of that tarsal tunnel of that, in that fascia. And so it's those three things, that's what we call the painful triad. All are treated with a good arch support, but there are different things that we can do to help in other areas. Sometimes you'll get tears of that tendon, and then you're really in trouble. So we try to prevent that with support. The good shoes, as Rachel said, we appreciate her being here too. Thanks, Rachel. And we send a lot of patients down there because there are good and bad shoes, as you may or may not know. We know that we're always pulling shoes off, and we're always taking and showing shoes, but a good shoe is going to bend at this area. Often in our day and age now, we see a lot of shoes that bend at the arch area, right in the arch, like a Free or some of these. I'm not going to mention names, but there are some that don't give you the support that you need. And if you did that with your foot, if you bent in that area, that's an area that's not really meant to bend. And so that's where a good arch or a good shoe is very important, and it'll prevent a lot of this. So we can't say enough about shoes. So that's the tendonitis, and sometimes you'll see even collapse as that tendon blows out. that foot will collapse and the toes will go out to the outside, and people will have other problems as a result. Other problems like gout. Gout is another thing that can cause heel pain. Sometimes you'll get, it's a disorder that will, it's a uric acid crystals. Generally it happens in the big toe joint, but sometimes we'll see that down in the heel. We'll see enthesiopathies or pull off of the Achilles tendon. We'll see spurs as a result of that. Is a spur always related? Is there always a correlation between a spur, a heel spur, and pain? Does anybody have any ideas on that? If I have a spur on my heel, does that just necessarily mean that it's going to be painful? Not always. Yeah, actually, they've done studies and they found that, some, like half they took 100 patients, and half of them didn't even know they had a spur in that area. And so it really depends on a few things, and Luke may talk a little bit about that as well. But there's a lot of different factors involved. But the majority, it's a tearing. It's the position of your foot. It's the tearing of the fascia. All those factors that can cause problems. We also occasionally see tumors in the foot. There's sometimes a little tumor in that area. That's why we usually get an X-ray. You'll say, well, why do I need an X-ray when I come in? Well, we'll look for spurs, but we'll also look for something unusual too. Very, very unusual that you would ever have a tumor. Most common one is this intraosseous lipoma. It's just it's like a fat tumor inside that big bone. This heel bone is like an egg, it's kind of, it can be almost like it's a hollow, but it's not. It's a different type of bone. We enjoy working with athletes, keeping you very active, whatever walk of life you're in. It doesn't matter what job you're in. My goal, and I know Luke's too, these guys have a gym in their office. They want you to be healthy. They want you to be active. And that's what this is all about, getting you back to full health, getting you back so that you feel like, yeah, I can lose some weight, or whatever you're doing. I can get up and I can get going, so I can be more active and I can do those things. And so that's what this is all about. The one other thing I just want to talk about is Achilles tendon problems, because that's really part of the heel as well. And sometimes we'll have a spur right on the back of the heel. Those spurs tend to be more tender because the Achilles tendon, the longest, strongest tendon in the body, attaches right down here on the bottom of that heel bone. And so that tendon has to, if there's a big spur on the back here, then it hits right on that tendon. And that sometimes requires surgery. Sometimes it's just a modification of shoes, physical therapy, or other modalities, stretching. So they found, I remember when I was a kid, they told us that the PE teacher would say, don't do this bouncing, when you're stretching. Don't bounce, or don't. And really, actually, now they found that eccentric rehabilitation, we kind of call it eccentric, where you're different motions, where you're one leg, or you're with weight, or a drop on the box. Those are better ways, and they found that tends to be a little more rehabilitative for those Achilles tendon, for that tendon to help heal that. Sometimes you'll get little just knobs in there, and we have to make that go away. Stretching, sometimes we do a lengthening actually of that heel cord, but there are other modalities that we can try, and new things out there as well. This is intended to be more of an interactive lecture, so I'd love to field any questions that I didn't cover in this today. You guys, looks like, Adam, you got a question back there?
Let's see.
You were just resting like that.
So, what would you do for rheumatoid arthritis? Does that affect your ankle joints? Do you have a lot of problems down here? your feet area? What would you do to address something like that?
Absolutely, yeah. We'll see with rheumatoid arthritis, as you know, the deformities will, you know, those in severe cases, and it used to be before medicines, they started having these demarcs, some of the medicines that can help with that. You'll see the hands go the other way, you'll see the big bunions, you'll see the major deformities, but a lot of that can also cause some arthritis or esthesionopathy, some pull on of the tendon and that stuff. So you're treating it very much in a similar way. Good shoes, stretching, arch supports, sometimes an injection or something like that. But it's a lot of that is medical therapy. You're following your rheumatologist or your primary care that's working with you on that. Really makes a big difference. Any other questions? Or
Yeah, I
thoughts
think
you
for
might
me
have?
too, with rheumatoid, mostly in my toes, like the metatarsal heads there,
Right.
is where I first got it. And I actually had plantar fasciitis as a kid though. I had all these things as a kid, and I was like, maybe that was just part of the initial stages of rheumatoid, but definitely shoe wear and medication and lifestyle changes and stuff.
I would say one more thing. We have another child in the audience here, young lady, that we're glad she came. But one other problem, and this is to make it a little more comprehensive. Children can have pretty bad heel pain, and generally tends to be right around those ages of as they're developing, the puberty times. Where the heel will, we call it Seaver's disease, and that's basically where the heel can, you can have a little, the growth plate of the heel, right on the back of that heel, will be injured. Sometimes it can be fractured. It can have a lot of inflammation. And so with kids, there's, you definitely don't, and any Achilles tendon, I never inject steroid into that area because that can weaken that tendon. It's not a good place for that. But with kids stretching, arch supports, good shoes, all those, but we see those often. I see a kid coming in and their heels are so tender, and that's one of the most common areas, is what we call calcaneal apophysitis or Seaver's disease. Any other questions? Okay.
Tina, did you have a bone spur on your Achilles?
Yeah, I had two of them on the back of my heel, and come to find out it was shredding the tendon.
Yeah.
Excellent.
So I had that repaired, and then I fell and ruptured the tendon again, so.
Oh, my word.
Why not?
Why not, I mean,
Yeah.
2 or 3 surgeries, that's not.
Yeah.
So do you want to get up here and talk to us?
Oh,
You're on 2 cameras.
Well, actually, one of the questions was, I was gonna see about injections for the torn Achilles, but you just touched on that, so there goes that idea.
Yeah, I wouldn't recommend it. There are some other ideas. I mean, they talk about platelet-rich plasma, PRP. If you're getting any kinds of injections, sometimes that can, because of it, it's not a real area of high blood flow, and so if we can somehow increase that blood flow or get some of those good cells going into there, to growth cells, growth factors, to help it to heal up, that seems to help a lot. So that would be the only injection per se, not necessarily steroid. Or if we do a steroid injection, we'd be in a cast, just like what you're in. I'd immobilize them that way. They're not gonna, cause a rupture or have other problems.
So do you recommend getting like an insole from you versus like a Dr. Scholl's? You know what I mean? Because so my boots,
Were you a plant back there? Or Thank you.
last
Yeah.
month, I started having this crazy pain all the way up my leg as I was walking. It just ache going up into the knee. So I was like, well, I'm gonna go gelling. So I just decided that I was gonna be gelling, and
Yeah.
it's helped, but it doesn't last long.
But it doesn't raise your arch up. It doesn't do anything
I'll take it.
for the gel. Is just going to cushion. It's just going to be a cushion.
Yeah.
But it doesn't really lift this arch or support this structure. And not everybody needs a high arch or a structure there to lift up that arch. I mean, we've all heard about the barefoot runners and all that stuff. And I think That's great if you grew up without shoes and if you grew up
Condition.
with a high arch. But most of us, like in my family, really low arch and have needing some other problem or needing some, we had surgery and other things to fix that. But yeah, not all orthotics are created equal. And so when you go in, and I'm not going to say any names, but you go to a certain store and you stand on this scanner and they tell you whether it's a high or low arch.
So rhyme with Walmart?
There's a lot of variability. Our friends at Soul Solutions, theirs tends to be a little more objective. It's a little more valid than what you get at a store like that. And you pay. The cost is usually less than those ones that you would have got at the other store there. So most places will have, like these are the ones that we have at our office, the Power Step. It's a good supportive device, has a cushion in it, has a little extra heel pad. There's different types there. Those are the ones that we do. And then what we'll often do is, like I said, if we'll tape, we can do a taping. If anybody wants to learn or wants to get their foot taped today, we can do that. You got to take her over here. Okay. And then we can, if that helps, a lot of times your insurance will cover a custom pair of orthotics. I'm not a big fan of the hard pair. We've seen some of these, but I like a little more cushion, but also the support that you need, and it's a real thin device that'll fit in most of your shoes. We can make these for dress shoes or for skiing, for any activities, something that's a little less, but they are a little more expensive. They should last you 5 to 10 years rather than just the,
Yeah.
3 or 6 months.
Yeah.
So with the hard pair, would that make up for if you had like a pair of the shoes that bend in the center? It would kind of be an adverse, right?
Correct. Yeah, that's what I tell people exactly. So you put a good $400 orthotic in there, and then your shoes are great shoes. But yeah, a lot of insurances, and we check all that. We do all the pre-authorizations and check all that and make sure see if the insurance cover that.
I guess depend on the price of them, just buy a pair of shoes, right?
Right, yeah, that's what I was thinking.
Yeah.
Is this similar? When I was a kid, my brother and sister both had orthotics, and they had like a hard plastic thing that the doctor molded to.
Very similar.
It's just
Yeah.
got with a casing around it?
Yes, yeah, that's an over-the-counter one. The ones that Rachel has at Soul Solutions, they're great ones. Soul is one brand, Superfeet is another brand that you'll see at like REI, some of these other stores.
Linkos.
Oh, you have Linkos too? Yeah.
And we just brought in Need.
Need?
It's a hybrid between Soul and Superfeet, like
Okay.
right in the middle.
Okay, I'm need to come in and check it out.
Come in
Yeah,
and
it's
try
been a little
it.
while.
Yeah, your custom ones are molded to your foot.
Yes.
And the way we used to do it was we would plaster people. He's got a really fancy device on his iPad.
And we're giving a pair of those away today, free. So hopefully you'll win.
They are so nice.
What we'll do, Stephanie's our, she's
She's got
I
a pair.
love mine.
I have a, go ahead, sorry.
I have a question, because
Yes.
years ago I had fractured my foot and I've sprained them several times. And at one point I had to get orthotics, but my foot never got adjusted. I know there's that growing pain of getting adjusted to it, and you eventually get used to it. My feet hurt for a long, I finally had to stop wearing them. They never
Yeah.
seemed to get used to it.
That
And
is
then
a
the doctor
great
was like,
question.
well, let's do surgery on your feet. And I'm like, so show me what's wrong. And he couldn't show me. He goes, there's lots of stuff in there you can't see. I'm like, yeah, you're not doing surgery on the foundation of my body without being able to substantiate.
You're smart. That's wise. That is definitely good. We guarantee ours 100%. So if they don't help you, if they don't, then you give them back. I mean, we pay you back. No cost out from you. There are some feet that don't do well with supports or orthotics. Sometimes there's a bone that's fused. These two bones are fused, and and they're fused in a position, but if you try to move that out of position, it's gonna hurt. I'm not saying that's what's the case with you, but we will modify those orthotics. We'll change them to where, you know, they'll work for you or we give them back to you. But there should be a good reason. And before I would do any surgery, if that, in that case, I'd probably get more data, like a CT scan or an MRI or nerve conduction studies or other things to try to help, you know, solve the pieces of the puzzle. But that's a great question. Thank you. Beverly?
I read about 4 or 5 years ago in Reader's Digest that in some country they were giving muscle relaxant shots in the calf to help heal plantar fasciitis. Is that something we're doing in the U.S. yet?
Muscle relaxant shots for plantar fasciitis in the calf.
To relieve the tightness?
Yeah,
Because I've got it going all the way back up my leg now.
And it is. That's one of the things we'll talk about. The stretching is so critical.
I've done all of that.
You've done all that. You
I've
know,
been
the
to a
different-
podiatrist. I've done everything they've recommended, starting with icing the foot and then 9 Advil a day for 10 days.
And so then you think,
And
well,
the taping and the shots, and I've worn the boots to bed for like 5 months. And I have
that's
done.
why you're here.
I have
I'm glad
done
you're here.
everything they've recommended, and as a last resort, he said, well, I can do one of 2 operations. We can cut down the side of your foot and across the fascia, or poke 18 holes in each heel. And I said, no, thank you. So
We call that topaz. And but then you're not, like you're saying, you're not treating the cause of the problem. So what is the cause? What is causing that to happen? The Achilles tendon, that longest, strongest tendon in the body, that attaches. Well, it comes down on the heel, and then the plantar fascia is a continuation of that. It's a ligamentous continuation of that really strong tendon. So if it's tied up here at your heel, or at your calf, which you're saying, then really the smarter thing would be to lengthen your heel cord, and I know that sounds aggressive, very aggressive. A lot of people aren't ready to jump into that. They might say, well, go ahead and shoot some stuff into my calf, see if we can relax it.
and
that
if
way.
stretching doesn't work, how do you lengthen it?
There's a great procedure called the gastrocnemius recession, been around for years, and we can do it endoscopically, or we can do it just with a little open technique, a little open incision on the inside. And basically what you're doing is cutting between the gastrocnemius muscle and the soleus muscle. There's a little ligamentous band or aponeurosis that goes in there. So my hand signals probably don't really work too well, so I'm trying to. So if this is the back of your heel here, and the calf, you know, comes down, and then you got the. Oh, this isn't the greatest. Anyway. Can you go and take 2 on this? My artist work anyway.
Not enough.
Art wasn't part of your college.
Gotta be confident.
I'm not Frank Netter.
Bob Ross.
Start from the top.
But we're not cutting into the Achilles tendon. Sometimes they'll actually cut little small, like a tendo-Achilles lengthening back here, and it'll weaken your Achilles tendon. I actually do this gastrocnemius recession where we're actually releasing the fibers between those 2 muscles, and that allows your foot a lot more stretch. And so they've done, actually there's some great studies out that when they said when we did that for heel pain, it tended to be more effective than going down and doing your 18 holes, the topaz, or going and cutting the fascia, which that fascia is kind of important to hold up that arch. And so
Yeah, you
they're-
did tell me it would weaken your foot, and I said, that's when I said, no, thank you.
So you guys are, I mean, this is great, good, excellent questions, and I think this is what most people are, these questions and these concerns are what most people are having.
Yeah.
Thank you.
Good.
You had a question.
I just wanted to ask, are the orthotics ever helpful for the torn Achilles or the healing of that tendon or?
Yes.
Oh, they can be?
Yes, because what happens with the Achilles tendon is that tendon, as it comes down, it kind of takes a 90-degree turn, and it attaches, the most of it attaches on the inside of your heel. 75% of those fibers do. And so you think about it, if that foot's pronating, if that arch is flattening out, well, it's causing some strain on that Achilles tendon. The reason why people have shin splints, or they'll have other, just when you're working out, when you're going hard, that can often be a problem. So that's why that support is very important, whether it be a good shoe or a good orthotic.
Okay. Thank you.
I'll do some recap if you don't mind. Thanks, Dr.
Yeah.
Clark.
Honey,
All right. I'm gonna draw some pictures. And like he said, in just a few minutes, we'll actually do some demonstrations on people with heel pain. So, no surgery though. Actually, that was a question too. I think a common one. How many folks end up having surgery? If 100 people come to your office for heel pain, how many of them will require surgery? Do you think?
less than 5%.
Cool.
Very, very, very rare.
Sorry, Ashley.
Don't do it, don't.
I'm just gonna start crying.
Sorry.
She'll just charge you. Yeah.
You're no longer welcome. Everybody,
Everybody out.
you're out.
See ya.
We have none of raffles though.
Shoot.
Good. So just to recap, what do you guys think? So you got heel pain. What do you guys think is the biggest mistake folks make who have heel pain?
Wrong shoes.
Wrong shoes, big mistake. Yeah.
Going barefoot.
Footwear is part of it. Barefoot, definitely.
Not addressing it.
Who said that? Nice job, Chris. So it's so common. You know, we're all busy.
He said his wife made him come.
Yeah, we all like to ignore it, right? Because if we ignore it long enough, it will go away.
No.
Oh, sorry. Yes, it will. So you do to me sometimes. Yeah, so that's the biggest mistake you see is you try to ignore it. What happens when you ignore heel pain?
It gets worse.
It gets worse. So it gets worse, you're tired of ignoring it, so what's your next step you could do? Instead of ignoring it, you mentioned it, Beverly, you could take an ibuprofen,
Yeah.
right?
Take 9 Advil a day.
Yeah, 9 Advil a day.
Well,
so that's, your
that's
second
what the
mistake.
podiatrist told me to do.
Yeah, so that's your second mistake is you try to mask it. You told her to do that?
No, it wasn't him.
Man. Yeah.
Different doctor.
So those are your two biggest mistakes. Once you get frustrated enough, you sign up for a heel pain workshop, and you decide that you might just decide to deal with it, right? So hopefully most of you are at this stage, or maybe you're not actually that bad yet, and you can take some of the stuff. So the most important step then, when you're ready to deal with it, and you're not going to ignore it anymore, and you're not going to mask it anymore, hopefully, is, and like I mentioned this earlier, is that when it comes to heel pain, you have to really be ready to take like a multi-dimensional approach. So some things that work, I just wanted to recap this. Footwear is obviously a big deal, right? Does everyone know how to do calf stretches? For the most part.
Thanks, Gene.
So frequent calf stretching. Yeah, exactly. And especially with plantar fasciitis, you know, I'll tell people, well, you're stretching your calves, right? Okay, I'm stretching my calves. Check your technique first of all, because sometimes you're stretching it wrong. Like Dr. Clark mentioned, Brent, sorry, Dr. Clark. Brent, you got 2 muscles, so stretching both of those muscles is a different technique. The other thing I get is like, say, well, how often are you stretching your muscles? Oh, I'm stretching once a day. How long do you hold it? About 10 seconds. Okay. So most of our patients with plantar fasciitis, you want to hold that stretch for a good 30 to 60 seconds. Do it a couple times in each foot, and do it upwards of 5 times a day. Like Brent mentioned several times, longest, strongest tendon in your body. What you're stretching actually is that muscular complex, and if you can release the tension on there, you can release the tension on the bottom of your heel. You combine that again with proper footwear, arch supports, night splints, things like that, then you've got a chance of getting rid of it. And if you're only willing to kind of go halfway, that's about what you'll get out of it in the end. So that was just my final recap. There's a lot of things you can do. Before we get into the treatments, what I'll say too is that if you're dealing with it, you're struggling with it, and you want to just get some more free information, we do offer free screens here at the clinic with one of our PTs. So it's a 30-minute just sit down and ask questions with one of the PTs. And then obviously you can refer yourself. Most insurances you can refer straight to Dr. Clark and just go from there. It's an old habit, I'm sorry. So anyways, any last questions on that?